Hello, my name is Bailey, and this is my environment sweep before we begin. Okay. Hello, my name is Bailey. I'm going to be your nurse today. We're just going to be doing a head-to-toe assessment on you. It shouldn't take longer than about 15 minutes, okay? I'm just going to shut this door and wash my hands and raise this bed up. Can you tell me your name and date of birth?
December 30th, 2003 in Corey Stewart.
And can you tell me where you are?
The hospital.
And you know why you're here?
Yes, for a physical.
And you know what the date is?
December 5th, 2024.
Patient is alert and oriented ×4. She is dressed appropriately for the weather. She has good hygiene. She is speaking clear and normally. She's having unlabored breathing, and she is on room air. I'm gonna check your head for any bumps. Okay, no lumps or masses on her head. I'm gonna check her ears and her nose. No redness or draining in her ears or nose, and her lips are a normal color for her ethnicity. I'm gonna check your eyes now. If you'll look straight forward for me. Okay, pupils are about a 4. And after constriction, they're down to about a 2. And then, okay, follow my light with just your eyes, not your head. Alright, and then just look over my shoulder, and when I tell you to, look back at my pin. Now. Okay. Pupils are equal, round, responsive to light, and they accommodate. I'm going to check her carotid pulse now. Carotid pulse is a +2 bilaterally, and I'm going to check for JVD. No JVD noted, and no lumps or masses noted as well. I'm going to move on to your arms. Color looks normal for her ethnicity. The temperature and moisture is warm and dry. I'm going to check her radial pulse. 2+ bilaterally, regular rate and rhythm. And her brachial pulse. 2+ bilaterally, regular rate and rhythm. I'm going to check her cap refill. Cap refill is good, less than 3 seconds. If you'll squeeze and then push up and push down. And hand strength and muscle strength in the upper extremity was a 5. And there are no bony prominences noted on her arms. I'm going to check your skin turgor too. And skin turgor is normal. I'm going to move on to your heart now. No, I'm going to do your legs actually. Okay. Skin color looks normal for her ethnicity. The skin is warm and dry. Her posterior tibialis is a 2+ bilaterally, and the dorsalis pedis is a 2+ bilaterally. If you can push up on my hands, down on my hands, up on my hands, and down. She gets a 5 for muscle and grip strength on the lower extremities, and her cap refill is less than 3 seconds. And there are no bony prominences noted on the lower extremities. Okay, now I'm going to listen to your heart. I'm going to start with her aortic, which is on the second intercostal space on the right sternal border. Pulmonic, second intercostal space, left sternum border. Erb's point, second intercostal space. No, third intercostal space, left sternal border. Mitral, fourth intercostal space, left sternal border. And tricuspid, fifth intercostal space, mid-clavicular line. And I'm gonna take her apical pulse now. I got an apical pulse of 78, and I could hear S1 loudest at the apex and S2 loudest at the base. I'm gonna check your lungs now. I'm gonna check your anterior lungs. If you'll breathe in and out. Okay, lungs expanded symmetrically anteriorly. And I'm gonna listen to your lungs and count her respiratory rate. Okay. One. Two. 3. 4. 5. And 5. Okay. Lungs sound clear to auscultation anteriorly, no adventitious sounds, and her respiratory rate was 18. So if you will just lie flat, I'm going to check your abdomen. Her abdomen is flat with no distension. I am going to auscultate now, starting in the right lower quadrant. Okay. There was normal active bowel sounds. I'm going to palpate now. Okay. And there are no lumps or masses in her abdomen. And now I'm going to listen to her posterior lungs. I'm going to check for symmetrical expansion. You'll just breathe in and out. Okay, lungs expanded symmetrically posteriorly. And now I'm going to listen to her lung sounds. Can you turn it that way?
Mm-hmm.
Okay. 1. 2. 2. 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Okay, lungs sounded clear. Posteriorly, clear to auscultation, no adventitious sounds. And I'm just gonna check her back, okay? No abrasions on the back or skin breakdown. She has no lines, tubes, or drains. And so now I'm going to hand her her call light, make sure she has non-skid socks on, put her bed rails up, wash my hands, and say thank you.